All right, so hello everyone, and thank you for joining today. I know, again, as you might have heard us saying, it doesn't become easy as the days go by. And I really appreciate all of you taking the time and being with us today. Of course, we have a very exciting person today with us to talk about something that probably hasn't been talked about a whole lot, about how this COVID-19 has impacted people of different class, of different gender, of different caste differently. We know in India we have a myriad of identities, and these identities play out very prominently during this crisis, in fact. So we'll hear from her what she thinks and what she sees as the impact of this crisis on these different groups of people. Let me introduce Professor Leela Fernandes just a little bit. Professor Leela Fernandes is a Glenda Dickerson Collegiate Professor of Women's Studies and the Director of the Center for South Asian Studies at the University of Michigan. She is also Professor of Political Science and Sociology by Caste. Her scholarship focuses on questions of inequality and democratic politics in contemporary India. She is the author of 4 books, and she is currently contemplating a new book, which we would really wait to, we can't really wait to see getting the light of the day. It's going to be called Governing Water in India, Urbanization, Inequality, and the Liberalizing State. Exciting news, she will be starting a new appointment on July 1st, 2020 as the director of the Henry M. Jackson School of International Studies at the University of Washington, Seattle. Congratulations, Leela, and I'm hoping we will continue our association with Shivnad University with you, and you take the new place also to greater heights as you have done with the Center for South Asia Studies at the University of Michigan. So with that, Leela, it's all yours.
So thank you so much for your kind introduction. Can you hear me okay?
Yes, I can hear you all right.
Yeah, so the topic of inequality is a very broad one. I think if you look at the news media sort of internationally and in different countries, some of the unequal effects of the pandemic are very obvious. So for example, if you think of how unemployment hits different segments of the society differently, if you have wealth, if you have savings, you can withstand it a little bit better. There are some segments of society who have what we would call temporary work or casual work, who don't have, the kind of means of surviving. There are differences in terms of the kinds of work which we do. So some of us, like, for example, we can continue some of our work through video conferencing. Some sectors of the economy, workers cannot do that. And then there are also differences in terms of risks. So for example, those who are classified as essential workers are in a sense forced to, in a sense, go out into the pandemic. So I think in many ways, the pandemic, what it has done is it has both intensified and made kind of hyper visible these kinds of economic inequalities. But what I would like to do today, just as a way of sparking thought and sparking reflection, is not so much focus on just these kinds of economic effects of inequality, but to basically use the pandemic, or ask us to use the COVID-19 as a kind of period for reflection on the complexities of different forms of economic and social inequality. Because inequality itself is not a single thing. As you mentioned, just in terms of contemporary India, for example, economic inequality of income or job status connects in complicated ways with gender, with caste, with ethnicity. It varies depending on the region in India. In the United States, where I'm located, economic inequality is complicated by racial and ethnic inequality, which are historical forces. So inequality itself is layered, it is complex, the different forms of inequality interact with each other. And so what I was hoping we would do today is just use the pandemic as a moment to reflect on these complexities. And I think what I would like to do, as I was thinking about how to frame such a complicated and big subject, is I think what I'd like to do is focus a little bit not on the simple or the sort of major economic effects in terms of income or economic inequality, but to think about how the responses and the solutions to handling the COVID-19 themselves show us some of these complexities. And I'm hoping this session will be more interactive. So in order to be more brief, what I will do is I'll give you 3 examples of the different responses. And the responses do vary by country, but there are also kind of underlying sort of patterns. So I think this will be sort of broadly relevant. So let's just start with the first one, which all of us are coping with, which is just being under lockdown. We started off chatting informally about how much of a strain it is, psychologically and economically, et cetera, for different groups of people. But if you think of, just to think for a moment a little bit more in a more complex way of the idea of stay at home. So the idea of stay at home is to bring us safety. It is clearly a necessary medical and policy response, but scholars who have worked on gender, both within the academy as well as in terms of policy and practical work, have really asked us to think about the home in more complicated ways. So what does stay at home mean in terms of gender inequality would be the first thing that we would want to think about. So for example, what scholars of gender have shown us is that the home has often had very unequal divisions of labor, right? So women are often tasked with, although that's changing with time, but still there tends to be a way in which women are tasked with certain kinds of household labor. So as labor gets intensified, as presence, social and physical presence of families get intensified in the home, what does that mean for women's roles, for gender inequalities would be an example. A second example, which I know this has been the case in the United States. I don't have much data because this is something we're living with, but scholars have, and activists and policymakers have talked about the fact that stay-at-home orders have very complicated effects for women who may be experiencing domestic violence. So in those kinds of cases, staying at home does not have the same experience of safety. So that you might have safety from the virus, but being enclosed in your house, if you are in a domestic violence situation, can be very scary. And it can be compounded by the fact that if you have cultural taboos where women don't feel like they can break the silence and maybe tell relatives or tell family members, women who are in that experience may be experiencing the stay-at-home order in a very different kind of way. So that's an example of what I mean by saying, let us think about how even the solutions to, or the responses, the necessary responses to COVID-19 shows us a layer of that kind of gender inequality and makes us think about the differences that different segments of society would be experiencing. Secondly, again, to think of the stay-at-home order, and I know this is something which India has been focused on a lot, is that stay-at-home also sometimes presumes a privilege of space. So a lot of times, if you think of the stay-at-home order, if you think of it from a middle-class perspective, we assume a household. We assume a house with, sturdy walls, a roof. There's a level of physical, spatial comfort and privilege which could be assumed from a middle-class perspective. That would not be true of lower socioeconomic communities. I think India has seen firsthand, and you would know this better than I am because you're there firsthand, what happened to migrant workers who did not actually, they were kind of in a liminal space. You can think even globally what this means for refugees who don't have permanent homes. And a lot of times, whether it's migrant workers or factory workers or workers living in low-income settlements, these are very highly dense areas where you just simply don't have the privilege of spatial physical distancing, which the stay-at-home order presumes. So there's, in some ways, there's already a privilege, a social and economic privilege associated with the idea of a stay-at-home order, and it connects with questions of gender, questions of socioeconomic division, etc. So those are some of the examples in the first sort of overarching solution which I've been thinking of. Another one which is smaller, but which is I think as significant, and I've been thinking about this also because it connects with my current research, is that one of the main things we have to do in addressing COVID-19, and everybody says that, is wash your hands. Something which many people will be familiar with if they're in water scarce areas in India is that not everybody has the same access to water resources. So for example, my research in the past few years has been based in Chennai, which often has very strong and acute experiences of water scarcity, which actually cross socioeconomic boundaries. So even if you are middle class, you may not have access to running water all the time. It's particularly acute for communities who are less privileged. And then it's also, and this is something I don't have data on because we're living through this, but it's something to think about. In India, for example, historically, access to water has been mediated in complicated ways by caste and gender. So women are often given the responsibility of making sure that their water resources are brought, for example, in villages, or even in socioeconomic, lower socioeconomic communities. Women will collect water in pots if they don't have running water supply. And caste may mediate this, so because there have been long-standing social taboos of, for example, Dalits accessing sort of public water fountains. So there are lots of questions which we need to ask about what does something as simple as wash your hands mean for different social economic communities, and how does it vary based on how caste interacts with gender, which interacts with class, so that it's a much more complicated situation than just thinking of inequality as like a black box or a single thing. So that was the second example. And just to say that this is also not specific to India. So for example, I teach in Michigan, and one of the hardest hit places in my state is the city of Detroit, which again has particular histories of race and class inequality. One of the things that immediately became apparent is that the many low-income communities, often communities of color in Detroit, had their water connections shut off because they couldn't afford to pay. And so there had to be an emergency order saying, turn the connections back on because you can't have people washing their hands if they don't have water. And I think what COVID-19 is also forcing us to realize is that we cannot segregate ourselves anymore for those of us who are more privileged from those communities, because if they get sick, we get sick. And so it also forces us to think of that interconnection in different kinds of ways. And then finally, I will say the last thing, which is again a bigger concept, and this is more about thinking about inequality, not just in terms of income or wealth, but in terms of thinking about inequality and what it means for social prejudice and privilege. And so one of the things I've been thinking a lot about is, what does the idea of social distancing mean in the context of histories of in which certain kinds of groups were marked as not being pure, as being polluted. And again, it's not unique to India, because historically, if you look at different countries, different regions of the world, people's bodies have often been marked based whether by race or by class or by caste, sometimes by gender, that certain bodies have historically been viewed as polluted, as dirty, as taboo. And if you think about what the pandemic does to us individually, in some senses, it makes us kind of fearful of proximity to people, and for good reason, because we are supposed to distance. But what does that fearfulness of social proximity and physical proximity mean if we carry prejudices which may be latent, which we may not be thinking of, but which may surface when we come into contact with an individual or a group from a community which has a history of caste prejudice. So for example, if you think of Dalits in India, who have had to fight a lot of social discrimination to fight these kinds of taboos of purity and pollution, which are very entrenched. Similarly, in Western countries, a lot of times they are very deep-seated racial prejudices which have produced segregation. If you're African American in the United States, it's often risky because you're viewed as sort of like a threat, a social threat, oftentimes in many communities, and you're at risk of being harassed by the police, etc. There's a lot of data that shows that. And so what does social distancing mean if it sparks or somehow ignites those prejudices which are present in different ways in all societies, including in the United States and in India, which are the two cases that I focus a lot on in my life and in my research. So I think what I'm trying to do with these examples is to use the pandemic as a way of kind of sparking us to reflect on not just how the pandemic has hurt people just because everything is shut down economically, people are suffering, people are losing jobs, they're losing wages, but also even in our responses, because we are all situated structurally in different locations with different identities connected, how even the social and policy solutions can be experienced very different ways in terms of the axes which are focused on our gender and caste and class and race. And so for me, those are the kinds of things which I've been thinking about. I thought giving some examples would be concrete, would maybe spark some responses rather than me just continuing to lecture on. So maybe what I will do is stop here and see if there are questions, if you have responses or thoughts, or kind of throw it back to you.
Sure. We'll get some questions from the people around, so they can't speak out, but they will write their questions, and I would encourage everyone to do that. But while you were talking about it, I was thinking about it. The two things that I would like you to kind of reflect upon in some sense. The first thing that I was thinking about is, look, this particular virus, or the pandemic itself, what it has done is it has pushed us back to private places. Now, the public place has been abandoned completely.
Yes.
And, the inequalities that we talked about and all, in some sense, the public space and the public places are where all of that probably got mitigated to a certain extent.
Yeah.
Where people of different, identities, background, etc., could come and commingle to a certain extent. So now that we are all into our own confined spaces, do you think these inequalities will be, more entrenched, or how will it play out because of this particular situation?
Yeah, I think that's a really great question. So I think at some level we don't know, because we are in really new and unpredictable territory, because this is so big and it's so global that it's just, I don't think we've experienced it in any kind of way. So I would be so some of this will just be speculation, just for the sake of thinking.
Sure.
So some of the thoughts I had, the idea that you brought in about the public and private is really an important one, and it's a really interesting one, because just for example, feminist scholars have really spend a lot of time grappling with that, and trying to sort of break down that dichotomy. So what does it mean now when everybody is pushed into that private space? And so I think that's part of where some of those gendered dimensions become very heavy, because what does it mean where households already are domains where kind of like one key site where gendered politics play out. So if you're all confined in the private space, what does that mean for gendered issues? Can they, and it doesn't always have to be negative. Can women have can women have more authority? Can women have more of a role? In some cases, maybe a hopeful way of thinking about it. But I don't think we know, and it's hard to know because now you can't really start doing research yet. But the other side of it, which is what I was trying to say by the privilege of space, is I'm not sure how many people, I'm not sure what the push towards the private means, because I'm not sure that all communities can actually have access to that zone of privacy. You know what I'm saying? So if you're living in a basti, for example, how does that play out? Because even if you're in your small house, there's no real spatial distancing. You're using a public water pump. You don't have running water, so already you don't have. It's a completely different way of living than being able to turn on your faucet. So they're just access to basic resources, which will force you out of the kind of private zone, the way in which we think about it. So the experience of what is private and public, I think, will also be really complicated because of that. Is one thought which I think came to mind as well.
I think the questions have started coming. Okay, so there's one question which says, given pre-existing inequalities, what different solutions can we think of apart from lockdown and social distancing? So Yeah. So it's Professor Kamala Ganesh from Srinagar University. She has asked this question.
So I think that's a very difficult question, because it's just, in some ways, I think what makes it difficult is that the lockdown also is preventing us from implementing solutions because we can't even go out. I think at the biggest level, I think this should force us to think more about inequality in structural terms, because what the pandemic has shown us is that these structural inequalities were always there, and now it's just become, as I said, both accentuated in very horrific ways but also very visible because and also because we're forced to sit down and reflect on what is happening around us. So at the biggest level, we need to think very seriously about policy. So how are our policies, our social policies, our economic policies, what impact are they having? Even something as simple as healthcare, how access to, like, how are those systems structured so that once we get out of that, we don't repeat the same mistakes is one thing. And then the second thing has to do with, policymakers will have to think about, and we don't know how the pandemic is going to play out, and different countries are experiencing it differently. So US is actually not doing well because our death rates are continuing to skyrocket. So in some ways, we are one of the worst case situations right now. The question is, for example, in the US, how are we dealing with homeless populations? It's not enough, usually we block out homeless populations in the US. It often doesn't enter the everyday consciousness of sort of average Americans, but you can't do that anymore. And so it's not enough so we can't afford not to think about it. In some ways, it's also forcing us to deal with the inequality. So in some ways, if particular low-income communities are being hit by COVID-19, there has to be a solution that doesn't just say, you deliver medical help, but it has to think about the underlying issue of housing, right? So homeless communities have to have housing in the United States. And similarly in India, I think that the challenge is so much greater because of the sheer numbers of the people. But that's an example of thinking about the links between health and residence. I think one of the things that's happening in the US, which is not productive, is that some of the debates are being talked about as like health versus the economy, when in fact, all the experts know that you cannot separate them. I think similarly, if you think about health and the economy, you have to start thinking of it in terms of other policy relations. So the housing policy is also now about health policy. Sometimes we institutionally, we put them in separate silos. And so I cannot give us, if I could give specific answers, I think I'd be really happy. I would be happy. I don't know if anybody has answered, but I think we have to think about like institutional architecture, how we silo these different zones of policy as a response. That probably would be unsatisfying, but it's the best I can do.
No, right now, that's what we can do. We can kind of think about it, not really some with clear answers to many of these problems right now, right? Yeah. So there's a question from Soumya Sri, who asks, how has this pandemic helped in bridging the differences, or has it widened the gap?
I think this, I think again, it depends on where you're talking about. I think it's always a mixture of both things. I think, so I'm not on the ground in India, so let me talk about my own experience, because I think that will be more honest, because I don't know the everyday life in India. All I know is what the reports I'm getting, and other people might have ideas about India. But so for example, the US, it has bridged divides because it has made us think about other kinds of communities. There's I think one thing the virus is doing is it's forcing us to think about our connections, because it spreads so quickly, you cannot segregate yourself, because it's kind of like the idea of like building walls. You cannot build a wall around the virus, and so it's forcing us to think about our connections. So even the act of wearing a mask is, you're not wearing it for yourself, you're wearing it for the other person. So it's forcing yourself to think about protecting other people. And I think that part is a positive aspect, because it's making us think about connections. between communities, between ourselves as individuals. But like any kind of disease, it also so the structural inequalities get intensified, but also social prejudices always occur. So in the United States, for example, there are prejudices against Asian Americans, Chinese Americans in particular, because they're being blamed for the virus, even though they are Chinese Americans. So that's unfortunate, because there's always society is always complicated. There are always segments and individuals who will reach for the betterment of others. You see, for example, amazing stories of nurses and healthcare workers who are really sacrificing themselves. But then there are always ways in which people will address their fears by wanting to kind of blame a group or blame someone. So I think it's a mixture of both of those things.
Professor Jamin, and again from Shiv Universities, so she has an interesting question. I guess we have heard a lot about how race has played a role in UK right now, for example, it's being, but we haven't heard a lot about the Native Americans there in the US. How are they faring? What's going on with them?
Yeah, that's an excellent question. So again, this is based on my following news reports and analysis. So some of the there was a struggle within the in terms of the financial response to the Congress, the U.S. Congress. There was a struggle to make sure that Native Americans were not excluded from some of the financial help. And so that struggle was actually won, so that they were not excluded. So it's a battle always to get Native Americans counted and included. So that is something which has, which shows you that it is a fault line, the fact that there had to be a fight to make sure that Native American communities were not excluded. I know that at least one case, I'm forgetting which state it was, so I won't say the state, it's in the middle of the country where there has been a real outbreak in the Native American sort of national community, because Native American communities can also they have their own autonomous regions, and there have been reports of just real difficulty in terms of getting resources, not getting getting adequate healthcare assistance, etc. And so it's a very significant question. It's a really good question, both because, again, that's one of the examples of a community where there's a density, there's a kind of like uniqueness to the community, because it's in many ways, you have like nations, like you have Navajo Nation, and there was a battle to make sure they got the funds, but even with the funds, there are problems with the funds actually reaching them, and there are problems with resources reaching them. So it is a fault line. I think it's a really good question. So it's a problem, basically, is what I would say.
Swati Tanya Achari, she has to say that my observation has been that especially during the pandemic, women are more conscious in taking precautions and preventions as compared to men. As a result, women are being judged for being overcautious. Can we draw sort of any reason behind this behavior, creating a gender divide? Kind of interesting observation. That women are probably more cautious, and I did not realize that maybe they're being judged as being overcautious, but maybe they are. So, do you have any reaction to that? Maybe.
Yeah, so I don't know if that's true or not, but I'll take it as a given. But assuming that it's true, and just in terms of the observations, there could be many reasons for that, because it also has to do. This could be another example of how the intensity in the private zone, because women are responsible, for sustenance, for basically the maintenance of family, everything from water resources to food to child, care. There are always these gender divisions of labor. So health sort of probably comes within that, which may make women more conscious, but also maybe more responsible. Maybe women are also having designated responsibilities, which could be part of the gender division of labor. So it could be that what's happening de facto is that gender divisions of labor mean that women are actually tasked with doing, focusing on the health, focusing on making sure that there's social distancing and people are wearing masks. So that could be an aspect of the gender dimensions. Was there another part of the question that I'm missing?
Let's see. No, I think you kind of addressed that, yeah. So there's another question from Joshita Yadav. She says that, can we discuss the impact of COVID-19 on trans and non-binary communities and their plight? I don't know if you have studied them or if you have any sense of what's going on with these communities, but if you would want to react to that.
So I don't. So I teach about transgender, non-binary. So that's part of my teaching because my part of my appointment is in women's studies. So I'm familiar with the issues that those communities deal with, but I've not actually seen anything in terms of the actual relationship with COVID-19. But I could imagine, you know, if I were against, because a lot of what we're doing is reflecting and speculating now, is I could imagine it's also a situation where home is very complicated in terms of what it means for different, you know, different people from different sexual orientations. Because a lot of times, if you're trying to transform normative ways of being, you know, home and family are often the most normative spaces, and so I could speculate that that would mean certain things. And also, I think sometimes transgendered individuals can often have particular kinds of, depending on, you know, there's variation of class, but they're often, this is where intersections matter. So transgender individuals who are not as well off, maybe who are homeless, maybe who have left home, there could be very, very specific kinds of threats of safety, you know, vulnerabilities that we haven't thought about yet. But it clearly, since I haven't seen any public reporting, but I'm sure that there are organizations who are working on that. I just have not been able to focus on that. It's a great question, though.
So Shruti Muralidharan, who's again a professor at Shiv University, says, thank you, Prof. Fernandes. It's interesting to look at the problem of transit of migrant labor in India. It is quite how women migrant labor is invisible. It tells us how gender and city interact, especially women migrant labor and city. How do we make sense of this invisibility?
I think that's a really, really important question. I think a lot of times when the figure of the migrant is viewed in a male model, I just revert back to a very some of my very early research, but I think there's an underlying conceptual issue which may connect, because again, I'm not doing on the ground research right now in India because I can't travel right now. My very early work was on the jute mill workers, and I had done an ethnographic study where I actually went to the factories like every day to interact with workers, with managers, to get us to, it was basically a study on working class politics. And a lot of what I saw there in terms of space, in terms of gender, really was impactful. And you know, you see those trends resurface. But the jute mills were known basically as a male working force because women had been displaced in earlier historical periods, and they mainly viewed as male migrants. But in my research, I found many women who were working in the factories, but they were never counted because they were not on the permanent workforce. They were working as casual workers. And so there was never any formal record. And so part of what happens is record keeping makes those, in one level, I would assume that record keeping intensifies that gender invisibility, because there's no records and we presume it's a male worker, when in fact that's often not the case. It's just that women get hidden. I think the other thing is that we often there's sometimes so quantitative analysis is very important, but sometimes quantitative analysis can produce silences and invisibilities, because what it does is it makes us ignore the smaller numbers, which can be women. So for example, in the jute workforce, women were viewed as negligible, and the numbers were not huge, but they were a part of the workforce, and they were sustaining the factories. And just to give us an example of what it would be, so for example, a lot of times permanent male workers who were unionized would sometimes rent their jobs out to casual workers, and sometimes those would be women. And so again, that's one of the reasons I do qualitative research, is sometimes qualitative research allows you to get at those uncounted groups. And female migrant workers would be a very important example of that. It also complicates the issue of space, because female migrant workers also who have compounded problems, because not only do they not have the protection of like a middle class household, but they're even more vulnerable to things like sexual assault, harassment, etc., because they don't have that spatial privilege to protect them. So those are just some thoughts I would have based on some of my earlier work.
Thank you. And Pablo Hulwit, he asks, do you think that COVID-19 and the current lockdown in India will amplify existing trends of class segregation, gated societies, etc., framing the presence of the poor as a health risk for the privileged, or lead to more inclusive policies, that is, towards universal health care?
So I think we don't know.
Yeah.
Because I think that is a choice we have. I think one of the reasons we should use the pandemic now, when we're stuck, we're locked down, to think about these issues, because policies will set into place very quickly, and we have to think in advance. So right now, there would be a tendency to focus on just life under the lockdown. But what we should do, as the questioner is asking, is thinking about what's coming next, and where will the policies lead us? Because I think we need to make the right choices, because I think that it could go either way. I think we could learn the lesson that, we're all connected, that healthcare, housing, that these basic needs, they have to be to some extent universal and accessible, because we see the costs when they're not. Or we could go back and we could just sort of intensify our prejudices, our discriminations, and sort of try to take the wrong lesson from the lockdown, which is try to just preserve our own well-being and kind of segregate ourselves. And that would be the wrong lesson, because the virus is showing us that you cannot, as much as you want to, the virus won't observe those boundaries. And I'll just say one thing, which the questioner didn't ask, but it's implicit, is one of the things we want to think about is, what does the lockdown mean in terms of democratic rights and citizenship? Because your first question about public space has a lot of political implications. If we cannot gather in meetings, in discussions, even within academia, outside of academia, we have to be careful. And also the idea of a lockdown, that you're told you have to do, you have to stay here, which is necessary, but we have to make sure that that is an exceptional case, and it does not become normalized, where states in different, across the world cannot now have the presumption that they can suddenly tell you not to gather, not to, come together as citizens.
No, you're absolutely right. I think we are, in some sense, at a very critical stage in India, for sure, in many other countries, about these democratic rights and how we shape things up from here in terms of government responses and policies that shape up. For example, right now today, the labor laws in UP were all basically abundant. So, how things shape up in the future, it's going to be, well, lack of a better word, interesting. So
yeah, exactly. And I think the trick would be for everybody, and especially within universities like yours, especially among academics, because to some extent we have the privilege to think about those future questions now, because I'm sure that governments and policymakers are thinking about the future as well, and so that we don't get hit by things before it's too late to change the course, I think.
So there's another question by Ezhil Priyadarshini, asks, although the COVID-19 is still rampant, countries have started thinking of seizing the lockdown due to economic instabilities. So what are your thoughts on lives versus livelihood debate?
And so our country, United States, is an example of that, where different states are doing different things. I think it's being presented as a false choice right now, because I think we sometimes, there's a political scientist named Timothy Mitchell who has a really interesting book where he questions the idea of an economy as a bounded entity. And he talks about how that is a fairly recent construction. So we think of the economy versus life versus healthcare. And I think it's a false choice, because, so for example, those industries which are being defined as essential, workers don't have the choice right now of not going in. So they're already their lives are at risk. So for example, in the US, meatpacking plants are not officially, but they're basically, the workers are being mandated to go, and those are where some of the biggest outbreaks are coming out, in the middle of the country, which is why our deaths are still rising. So, and so it shows you that, and that's besides whether things are opening up or not. And I think, you know, the issue of livelihood is important because people who are the lower level, it is, if they don't have daily wages, it can be an issue of starvation, for example. And so it is, so life is also about getting employment. It's not, you know, it's a false choice. But there have to be other policy solutions rather than sending people to unsafe workplaces,
Right.
I think.
There's a question from Saran Chavan, who asks, do you think governments with female head of states have been able to respond better and make more empathetic policies during pandemic? I think New Zealand and Germany, obviously.
Yeah. So I don't think, so in terms of how I think about gender, I don't necessarily agree with that. I think Germany has, I think Angela Merkel has done a good job, but, and part of the reason I say that is I see a lot of variation in the United States, just in terms of, because we don't have a proper federal response. Really, if you have a governor who's doing the right thing, you are lucky right now. And there are female governors, like in my state has a very strong female governor who's doing the right things. There are male governors who are doing the right things. There is an example of a female governor who's making very bad choices in the United States, because she's basically, even where there are massive outbreaks, she's not having any, there are basically no restrictions. There's been no response. And so it's difficult for me to see the gender as determinant.
Dr. Nandimin, sorry, I'm messing up the names here again. Dr. Nandi Minti Venkata Ramamurthy asks, what are the major changes we can expect after this lockdown release with reference to education sector?
Yeah.
Again, I guess
that's a big one.
Very open question for all of us.
Yeah, I think I think it's going to be significant changes, because we don't know how long we'll have to do online and what version of online we're doing. I think there'll be differences between public and private universities, although even in the, I don't know how it is in India, but in the United States, even private universities are being hit because their endowments were affected by the stock market. I think it'll be very serious. I think the consequences will be very serious. I think if I can be a little bit more polemical right now, just for a moment, since I located in the academy, I think we have to be careful, just like with democratic rights. I think we have to be careful that this does not become the basis for wrong decisions, like decisions that cut back support for universities, decisions that cut back freedom of speech on campuses. You know, I think we have to be very vigilant to, you know, it's a balance of knowing that we have an emergency, which requires these kinds of extreme responses, but making sure that the emergency does not become a pretext, either consciously or unintentionally, that leads to encroachments on how education is valued, how, you know, education is a site for free thinking, for these kinds of conversations. So I think that we will have costs to our institutions, but I think our institutions will matter even more, because we will have to have the courage to ask difficult questions, you know, as we emerge out of this crisis, is what I think.
Absolutely, yeah. Let's see, one more question from Saili Shah. So my question is, how people from different class strata of the society are preserving basic healthcare facilities, for example, chronic diseases, beside the COVID-19 health solutions, or how the overall situation is impacting the basic healthcare facilities beside COVID-19. So I guess, yeah, I mean, none of us here are healthcare specialists, so we would need to know, but I think in some sense, I think she's asking that if this inequality of diseases is also playing out in some sense.
Yeah, so I wouldn't have data, but again, one could speculate that it will have effects because there already were problems of access to healthcare in different societies. I mean, obviously, some countries are doing better. Like Europe has a better, Western Europe has a better system. United States has always had inequalities. I think India has had inequalities, and so one would expect that to be intensified. And I think.
Yes, I mean, in India, for example, what we are observing and what we're seeing in data is the number of tuberculosis patients who are coming for checkups and clinic, because tuberculosis is a huge problem in India. That has dropped significantly. So I think, yes, these things will play out, and not having robust healthcare system in India definitely makes things worse.
Yeah. And I was just thinking, I'll say one more thing is that this is probably true in India as well. It's true in the United States. Is even before the virus hit, people without insurance or without access to, to resources were already making choices on which drugs to buy, which diseases to treat. And so if communities or individuals are losing employment or they're losing savings, it will become much more dire, I would say, to make really very difficult and choices that people should not have to make.
There's one question from Mandira Sharma. She says, do you think the COVID-19 pandemic gives us an opportunity to undo some of the long-standing problems of our societies, both in India and US, and to bring about policies that will make us forward in a more equitable society with universal healthcare system, equal opportunities for appropriate housing, and equality of job and educational opportunities?
Yes, yes, that's what I would hope for. But I don't think it will come naturally. Right. I think it will come through like citizen participation, and I think the challenging thing will be for us to not get so overwhelmed by the pandemic that we stop thinking about these questions, because the pandemic itself is so overwhelming, in terms of all the stresses that everybody's living through, that we have to not think of these fundamental questions of inequality. It's not a luxury to think of those, and we'll have to keep reminding ourselves, because there's so much, there's an impetus for us right now to just focus on survival because the pandemic is so overwhelming. But then we will lose that opportunity to do exactly what the questioner asked, which is to think about how do we make sure that we change our policies so that the next time we have a crisis, whether it's a pandemic or whether it's something else, we don't have this, just these very acute inequalities and lack of, it's not even just inequality, but it's lack of universal infrastructure for life across society.
Okay, I think let's take one last question. This is Ritika Parekh, who says, centralized, and in brackets, government-led or decentralized, which she thinks tech companies-led, contact tracing. So I guess it's about contact tracing apps. There are two different, as I'm trying to interpret the question here, there are two different types of contact tracing apps that's out there right now. One which the UK government and the Indian government does, which is centralized, and the other which is Apple and Google is trying to build, which is decentralized. No data is stored in any central server. I think she's referring to that. And the privacy concerns over the use of personal health data are legitimate. What are your views on personal data being used to fight the pandemic?
So I don't know as much about, I understand the basic question. We're not there, the United States is not there yet. We don't have apps yet, so we're a little bit behind the scenes.
We have an Arogya Setu app, which is actually, it's required for all government employees as well as private employees who have started working.
So I think, again, it's this tension in many of the answers between what we need immediately and then what the consequences are going to be. And I would say that for both the government and the private sector apps, there are concerns, in terms of how data can be used, so the private decentralized apps, there are privacy concerns, in terms of how companies could use your privacy information. for generally, for government data apps, there are concerns about, what would this mean in terms of like within elections? Could the government use apps and information, because data mining is such a, it's a big asset right now, and it has a lot of political, it's a big political and economic asset. And so I think both sides have risks that we need to keep thinking about.
No, you're absolutely right. I mean, I think that's the other tension that's playing out, which is the short-run solution versus a longer term, what we can think about in social welfare terms for probably even generations to come. So yeah, that is something that we'll have to keep an eye on as this unfolds. I think, thank you so much. It was very exciting and engrossing, and I think all our viewers and listeners here will share that. I really appreciate, taking the time off. I know it's not easy to do that these days. There's so many things going on. I hope, stay well and things really don't turn out to be worse in US or in India than it is right now. Though in India, the numbers are actually increasing, but yeah, we are hoping that we will see this out without a very catastrophic, death rates and things like that we've seen in other parts of the world. So, and to everyone here, again, please stay healthy, take care, and thank you for joining once more. Thank you again, for taking the time to be here and be with us. Thank you.
Thank you so much. Take care to all of you.
Thanks.
Bye.